Hi everybody, it's Dr. Cary here. I'm a chiropractor in Kelowna, British Columbia, and today we're talking about chiropractic. What is it? And I've been practicing chiropractic for over 25 years and went to see a chiropractor when I was a teenager. And that chiropractor really helped me with a knee condition. When I had gone to other doctors and specialists, this chiropractor was the one who solved my problem. And then that really inspired me to become a chiropractor. And over my career so far, 25 years, I've seen thousands of patients. A lot of patients ask me, what is chiropractic? And I get this from friends and family members, neighbors. So I really want to explain what chiropractic is today and how it can help you. So I think one of the first things that you need to understand about chiropractic is that it relates to the brain and the spinal cord and all the nerve roots. So we're primarily concerned about the nervous system and the structure of the body. So for example, the spine should be straight down the middle, but if it shifts or goes out of place, then it can affect the nerve flow going down the arm or going down the leg or going to the organs in the body. And this is very important because chiropractic started as a formal profession in 1895 with one adjustment. It had been practiced before this in ancient times. There's writings about it in Greek philosophy and literature. But really as a formal profession in 1895, Dr. Palmer, who is a Canadian and went down to study in Davenport, Iowa, did a adjustment to someone who put a bone out of place. And that bone was out of place at the first vertebrae, C1 in the neck, which is the atlas. And when he put that bone out of place, he couldn't hear very well. So he went to see Dr. Palmer, who was studying the spine and nervous system, and said, if you put this bone back in place, do you think my hearing would be restored? And Dr. Palmer's theory was if anything interfered with the nervous system, then the body couldn't function right. So basically what Dr. Palmer did is he adjusted the spine, put the bone back in place, and the effect of being out of place was reversed. So the hearing was restored, the body was able to function properly, and that was the start of chiropractic in 1895. Subsequent to that, chiropractic has been practiced all over the world. There's many different colleges that teach chiropractic, including the first one, Palmer College in Davenport, Iowa. And today there's many techniques. So the science of chiropractic has evolved. There's a lot more research being done on it and studies. The philosophy remains the same from the beginning, but there's different branches or focus on different areas of chiropractic. And the art of chiropractic, the techniques that are being used, has really developed and changed over time. So how do I practice chiropractic? Well, when someone calls the office and comes into the clinic, the first thing is they're usually in pain or discomfort. So I want to identify where the pain is coming from and doing a thorough history to understand their condition, when it started, how often they experience this condition, and what causes it is really important. So we do a thorough history. We do the examination, which includes postural pictures, ranges of motion, orthopedic neurologic tests, sometimes digital x-rays. And we want to look at the condition of the spine and how the spine and the joints are functioning in the body. So once we have a good understanding of that, then a diagnosis is made. We tell the patient what our recommendation is going forward. And if the patient's in agreement, we'll take the next steps of starting to do adjustments. And the way I do adjustments in the clinic is the traditional way, hands-on, where we adjust the bones back into alignment, and similar to the first chiropractic adjustment. And usually there's some popping or cracking noise with that, which is just the gas releasing and shifting between the bones. So that popping noise is just a byproduct of doing an adjustment. Now, some of the adjustments we do are using instruments. So I use an activator and an integrator. These instruments help to realign the spine and normalize the tone in the body. So bringing the body back into that normal tone where it's not too tight or too loose. And then we use tables in the clinic too, where we adjust primarily the bigger parts of the body, like the hips or the lower spine, using drop technique to realign and balance the hips and the leg lengths. So we do that in the clinic. I do use two modalities to help me. The modalities are shockwave and laser. And shockwave is a sound wave, laser is a light frequency, and this is to promote and accelerate the healing of a certain area. So that's how I practice chiropractic. After a few visits, I get to know how quickly the person's healing, if they're willing to do exercises, what other factors are playing a part in their recovery, and then I'll give them a report of findings. So the report of findings is the more formal one is after a few visits, where I make a recommendation that will tell them how many visits over what period of time. It'll include any products I'm recommending, maybe things like a pillow or a back belt or some nutritional products for their joints. And then I'll tell them when their reassessment's going to be. And the reassessment will be done to compare how they've progressed from the beginning to that time. And then what I'll do is make a recommendation going forward. So for the patient to take better care of themselves, for them to have a better lifestyle, and to be able to maintain the changes that we've made in the clinic. So that's how I manage care in the clinic. It's very successful at helping patients. We do get a lot of referrals from our patient base, and it allows me to work with the patient for their benefit and for them to get the best results out of the care. Now, sometimes patients ask, are you accepting new patients, or how do I book an appointment? So I wanted to show you that today. So just stick with me. If you're on Instagram, I'll tell you what to do. But here on our YouTube channel, I'm going to just show you our website. So people ask, how do I book an appointment? Here's our website right here. And if you go to drcaryyurkiw.com, now on Instagram, you can go to the link in the bio, click on that, and then you're going to get this page. And when you're on this page, you click on these three dashes and go to appointments. And when you go to appointments, the next thing you're going to see is enter your information. So if you enter your basic information by clicking book now, and then when you go to book now, you can pick a day and a time that's available and go to next. And then when you go to next, you're going to be asked for your basic information, first and last name, email address, phone number, and then the main reason for your appointment. And right now we have a promotion going on where you can get 10% off your initial session, and we'll send an additional 10% to Ukraine. So we're going to send an additional 10% to Ukraine and give you 10% off your initial chiropractic visit. So we think this is a wonderful opportunity. So if you can see my screen here, you would type in Ukraine in the promo code, click apply, and that'll take 10% off your initial visit, and we'll donate that same amount, another 10% over to Maria Aid. So I'll put a link in the show notes here, as well as I'll post about this over the next few days. But Maria Aid is a Canadian organization, a registered charity that is sending help over to Ukraine. So that's our charity right now that we're supporting. I'm just going to flip back over to our screen. So just bear with me for 1 second. And right over here. And that's the special offer we have for you right now. So use that coupon code Ukraine right now to book the appointment. And we can usually see a new patient within 48 hours. So if you're in pain and you would like to come into the clinic, we are seeing patients today on Sunday and holiday Monday as well. So feel free to contact us. You can message us here on social media. You can go right over to our website, book an appointment. You can always call me from the phone number in the contact info. And I'd be happy to book an appointment for you. We are seeing new patients today and tomorrow. We can usually see a new patient within 48 hours. And we do bill directly to insurance, no doctor referrals needed. So we will bill directly to insurance, and you just have to give us your insurance info, and we'd be happy to do that. So thanks for joining me today, and I hope to see you guys in the clinic soon.